The D Las Vegas's tiny TV on OC16, a busy Kapiolani and Pensacola. All the trucks and cars zooming by. I'm right across Inspiration, McKinley High School, the Blaisdell, McKinley Car Wash, where I get my car washed and gassed up. My Rogue from the Tony Group Autoplex. See how I fit all my sponsors in, which I also have the wedding ring shop right there. But I have Aloha Water in my car. Let's fit another sponsor in here. Yes, they set me up with my now bottled size so I can carry it with me. They have negatively charged water. They have regular bottled water for your office, home. This road, Pensacola, goes down there. Again, I'm here right now because, not just to mention my sponsors, but I'm going to fill a void in my life. And I know I said the wedding ring shop is there. And if you walk this way, this is the building with the old pancake house, the original pancake house. There's a clothes shop here. And then Princess Brides. So wedding ring shop, Princess Brides. You're probably wondering, what void is Tiny trying to fill in his life? Well, here's the void. Right there. Can you get that shot? It's the Gap. Okay, it's not the store The Gap, it's the Gap. MI2. I've had that for a while now. I want to get it filled. So in this building, the original pancake house, 6th floor, suite 620, Dr. Okabe. I understand he makes you feel real comfortable. If you hate going dentist, this is the guy you let go. Dr. Jonathan Okabe. Suite 620. Let's go and fill that void in my mouth, in my life.
Hi, Tiny. Welcome to Okabe Dental Arts.
What's your name?
My name is Aisha, and I want you to feel as comfortable and as ease as possible.
I already feel comfortable. A nice little place to relax, and I hear a little water going and everything. In fact, I might want to go shishi when I hear that water. So do you guys have a restroom here?
Yes, we do. So it's right actually outside the door. We actually recommend for our patients to use the bathroom because the procedure can be kind of lengthy.
Well, at my age, I got to go often. Now, also, do I fill out paperwork? What's my first step?
Just fill out the paperwork.
Obvious information is going to be confidential, right?
Of course. We abide by the HIPAA policies here.
Okay, Aisha, I finished my paperwork. That didn't take long at all. So what's the main thing? What's the crux of today's initial consulting meeting?
Okay, so for our new patients, we first of all take a full mouth x-rays just to make sure that everything's okay. And Dr. Okabe will come in and give you your exam.
Okay, and that'll just make sure I'm okay, my mouth is all right, and maybe there's more I need, right?
Absolutely. So we check for everything. We check your gums, we check your teeth for any decay. We also take a panoramic x-ray to check for cancer.
You guys got tons of rooms and equipment here, and well equipped, and the staff, lots of employees.
We actually only have a hygienist, an assistant for a doctor. So.
But a lot of assistants walking around, and I like that. They take care of you. Very clean. You guys actually take time to keep this place pretty spick and spam on your off days.
Absolutely. We actually take a day out of 2 weeks to make sure we thoroughly clean off our office and all our equipment.
Very important nowadays. And obviously in this first meeting I get to meet Dr. Okabe, the famous one that everyone wants to have work on their mouths.
Of course, Tiny. We're going to bring you in and see Dr. Okabe. He's specialized with patients who have anxieties to come to the dentist.
Hey, Dr. Okabe, how's it?
Hi, Tiny. How's it going?
I was just so excited to meet you because I hear so much about you, and I finally got in here, and you know my situation. In fact, let me tell you right now, I'll show people that I was telling them I have this gap, and I've been letting it kind of just stay for a long time. First off, what would you tell someone like me? Because I finally got in here, and we're kind of meeting for the first time, and I need to fix this.
Well, it's terrific that you're here because that's the hardest part. We deal with a lot of people who have barriers about fear, and it holds them back. The sooner you get this done, the more options you have and the more opportunities to choose something that's going to be worthwhile.
Because it's not going to go away. It can only get worse, right?
I've never seen a decay disappear. We've always seen it grow bigger and bigger, and it's easier to handle. a missing tooth is easier to handle when it just happens.
We're always wishing that cavity would go away, the pain would just stop, but we just got to come in. But you do deal with the anxiety, and you've been trained for that.
Yeah, I want to really help people get healthy. I want to help people who are afraid of dental work and having dental treatment. And in doing so, I got trained in oral sedation. I also am trained in nitrous oxide. And we have some anesthetic machines that are very comfortable to use. And we sit down and we listen to each patient. We try to give the patient ample appointment time so we don't have to rush. And we do a good job.
This is kind of a family operation because your employees, you guys are very close and they love you. But there's a picture in the back. That's your family, right?
Yeah, that's a while ago. My kids are now fully grown. And they gained some weight.
I'm sure they love you saying that.
Oh yeah. So yes, that's my family.
Oh, awesome. And we think this is a good family place to come. If somebody usually arrives here, they bring their kids or their friends, they tell everybody.
Yes. So we have families in our practice. We have multi-generations in our practice. We have grandma, great-grandma, or great-grandpa. So yeah, it's neat.
How many years have you been doing this?
Oh boy. Now you asked a ticklish subject. Actually, I graduated in 1976
From
USC, University of Southern California Dental School in Los Angeles. And so that puts me at 39 years.
Let's just say it, almost 40.
Yeah, 40.
But that's good. We want experience because you still have to go for training. And I see something that came out new was Invisalign, and you do that as well.
Oh yeah, we got trained quite a while ago for Invisalign. Also place dental implants. Mm-hmm. I have training in cosmetic dental veneers, doing the artwork for veneers. I do my own smile designs and hand sculpt the smile for each patient. There's a lot of stuff behind what we do that makes it personal and, of course, makes it come out great.
See ya.
Yeah, it's Dr. Okabe here. It's been about 8 weeks since I was here last, and I still have the puka.
The puka.
But inside is the, well, we'll show you a picture, the actual implant. But the reason why we waited so long is because I guess you gotta make sure it sets and everything, Doc?
Yeah. It's real prudent to wait and let the bone heal. Biologically or biology, for any bone healing, minimally is 6 to 8 weeks. If you had a broken arm and a cast on it, the doctors would wait 6 to 8 weeks, and you can't push it faster. Mm-hmm. And similarly, with these modern implants, these are they integrate, the bone grows to them in minimal 6 to 8 weeks. So sometimes people hear about immediate loading or creating a tooth right away. And in most instances, it works, but it's sometimes not prudent.
In the long run, it could be more detrimental, right?
It could cause the shakiness or the loss of the implant if the bone doesn't really heal fast.
Mm-hmm. Okay. See, we got a doc here who cares. He knows what he's doing, and they're known for using quality product, technique, and even, I guess the neat thing is getting rid of the anxiety of going to a regular dental place, right?
Yeah.
I mean, it's been cruise for me so far, and I've got, what, 2 more appointments, Doc?
Yes, and we'll be done.
Okay, so this one we're going to make a mold. Is that what it's called?
Yeah, we're going to take the record now for the fit of, so we can make the crown.
Okay, and then the next time I come and I put it in?
Yeah.
All
No
right.
pain, no shots. Everything from here is really smooth. We'll just fit it next time. We'll get good pictures so you can smile again.
We'll get rid of this.
The gap.
Okay, so I'll be back in a few weeks to fill that puka. So how long before I can eat food?
Right away.
You can eat right away.
I can eat? Okay. I love Dr. Okabe. And your name again?
Misa.
And Nisa. They take good care of me. And this is just to rinse?
Yeah.
Okay. Okay, today is the day. It is the final day with Dr. Okabe here. This is the before. And we've been doing stuff in between and getting it all measured up, but it's gonna go in the crown, right, Doc?
Yes.
Okay, so this
In
is
the space.
in this space. He says it nicely. And that's the after. I got a tooth. That was fast and painless, Dr. Okabe. This was the easiest one. You just screwed it in?
A little more than that, but yeah, I put some screws back in your brain.
Wow.
So you got screws now.
Yeah, but again,
No pain.
there's some restrictions. I'm not gonna eat, like you said, cow bee and chew on the bone or anything. But I mean, my smile, everything, it's like new.
And it should fit. You can dental floss it just like real teeth, and they're not. It's not connected to another tooth.
Okay,
This
perfect.
one has no cement.
No cement.
Yeah.
I like it.
It's retrievable. It's easier to care for and fix.
All right, and people can come and do this too, pain-free. It's again something you do as you gear towards those who don't like the regular dental fears, right? Anxiety.
Yeah. So we have nitrous oxide. I do a few patients that require oral sedation, and when these procedures can be real scary. In actuality, it can be done quite comfortably, and we try our best to take care of all the little steps that might create discomfort, and make sure we address those things ahead of time before we proceed.
I like it. There's even like some little music in the background, so it put me at ease. And the chair, the sunglasses to protect me from the light, everything. And the main thing is, I have a tooth now. So we're keeping all the information on the screen, so when you guys call, you can call and set up the same thing that I went through. It's a few steps, but well worth it to get a regular smile back. Thanks, Dr. Okabe.
Oh, you're welcome.
All right. Woohoo!